kind of like a new treatment, let's say. I don't want to call it revolutionary before you explain it.
Well, hypoglossal stimulation is, as it says, the stimulation of the nerve. Okay, that it's actually the nerve that opens up the airway. It's a nerve that pushes the tongue forward and at the same time the palate forward.
I'm calling on all partners, please do take a role in this and let your partner know.
Absolutely. Most of the time, the wife will complain, of course, that the husband snores a lot, and that is very, very common.
So it is not just about snoring, because as you said, we all snore at some point of our lives.
They don't only gain weight there, but over here also. Okay, in the neck, and also in the tongue, in the palate.
Untreated severe sleep apnea can actually affect the heart and the brain.
The body will tell you, hey, your brain tells you, wake up.
Wake up.
You need to start reading.
How do the hormones affect the way a woman brings up?
Well, because we have to enter different stages of sleep to get the rest.
Did you know that an estimated 1 billion people worldwide suffer from sleep apnea, yet most of them don't even know it? Sleep apnea isn't just about snoring. It's a condition that can quietly affect your heart, your brain, and your overall quality of life. Welcome back to Medical Dose, your podcast where we make medicine simple, clear, and practical. Today, we're diving into obstructive sleep apnea with one of the world's leading experts in the field, Dr. Peter Baptista, consultant in ENT surgery, who has published extensively on this condition. Hello, and very warm welcome to you, Dr. Peter. It's a pleasure to have you.
Thank you. It's my pleasure.
So let's start simple and straightforward. What is exactly obstructive sleep apnea, and how is it different from just light snoring?
Okay. So obstructive sleep apnea is a bit different to snoring. I mean, anybody could snore at a certain moment. If they're very tired and they had a few drinks, that is completely normal. However, obstructive sleep apnea is an obstruction that occurs where there is not enough air that enters the lungs. And if there's not enough air that enters the lungs, there's not going to be enough air or oxygen in the blood. And therefore, the patient's going to wake up. Mm-hmm. This is going to make things much more difficult for the patient because during the night, when they wake up in the morning, they're going to feel tired. They're going to feel like excessively fatigued. So it's going to change their lives completely.
And as I've mentioned, doctor, a lot of people don't know because that they have sleep apnea because they're mere sleeping.
That's right.
So how do they know? What are the symptoms?
During the night, they might not be able to have knowledge that they're actually having obstructive sleep apnea unless their partner, either their bed partner, or I would say somebody else in the room, the partner is going to be able to tell them. Or they're sometimes even the neighbors might hear them snoring.
Oh.
Okay, that happens sometimes. But yes, during the day, however, they might feel very tired, fatigued. They might tend to forget things. They have memory loss. They will feel that they're in that constant cloud during the day. And on top of that, they might start to have high blood pressure, high cholesterol, high sugar levels, many other aspects.
We're really trying to touch on these important points and the health risks, let's say, that result in untreated sleep apnea. But before that, I'm calling on all partners, please do take a role in this. And let your partner know.
Absolutely.
It is dangerous. And let's talk about why is it dangerous if it's left untreated?
Well, you could go through life, I would say, without noticing. However, if a patient, a family member or somebody else is noticing this problem, they do have to have in mind that it's going to make important changes for the person because that person is going to start to feel and try to the behavior is going to be different. So most of the time, the wife will complain, of course, that the husband snores a lot, and that is very, very common. But they have to realize that especially if they see them gasping, if they see them, they stop breathing during the night. And on top of that, during the day, their normal activities is not the same. That is an important sign that sleep apnea
All right.
is there.
So it is not just about snoring, because as you said, we all snore at some points of our lives. That's
Things.
normal one. But if there's gasping, there's
That's right. Yeah.
so there you cannot capture your breath. That's when we should be
Stopping. So yes, suddenly the patient starts.
okay. Well, okay.
Wakes up suddenly.
And
Yeah. That is part of
that is alarming.
Yeah, that's alarming. And that might happen. I mean, it could happen not only to males, but also to females. I mean, it could happen to women also, and also to children. That is an important aspect to have.
Great to mention that, because I was just going to ask you. It's always the ladies complaining about their partners for loud snoring or having sleep apnea. But do ladies have as well sleep apnea? And why is it more common than in men?
It's much more common in men during lifetime, and as the men grows older, it gets worse. However, in women, okay, there are actually different problems that occur, and from menopause on, it becomes equal between men and women.
Oh,
okay, I'll explain why. During an early age in women, it's very common, especially in women that have polycystic ovarian syndrome, where there are hormonal changes in your body, and also during pregnancy. So snoring and sleep apnea might be present in those two conditions. However, during menopause or perimenopause, that's a different story, because there are hormonal changes that are going to make the woman equal to men. So that's I mean, if you're
but is that like scientifically, if you could explain?
Yes. Well,
how do the hormones affect the way a woman brings up?
Well, because actually the hormones have an important factor. First, of the tone of the muscles, but on top of that, it's women start to gain weight, okay, because of those hormonal changes that occur in a certain moment. So that is why. I mean, after, let's say, after a woman stops having their menstruation, or if the cycle starts to change, at that moment, there are different aspects, hormonal aspects that are occurring, and that woman starts to gain weight. Okay, and when they start to gain weight, where do they gain weight? They always gain weight in their different parts of their body. They don't only gain weight there, but over here also. Okay, in their neck, and also in the tongue and the palate. So it becomes practically equal in men and women after a certain age. So you have to have in mind that there is a genetic predisposition for it. So if your mother or father snores, okay, you're probably going to snore too. So that's going to happen.
Mm-hmm.
So it's part of life.
Right. It's part of life. And it's good to hear that there are treatments if it reaches to a very extensive case or to a very advanced case. But before we go and touch on treatments, before we go to that point, you mentioned that untreated severe sleep apnea can actually affect the heart and the brain. Are those real concerns and heart, health risks?
Absolutely. That's something that has been demonstrated. But it's not only going to affect the brain, the heart, it affects the whole body. So how does this work? Well, it's quite simple. I mean, if I explain to you in a simple way, first of all, the patient stops breathing during the night, okay, but not once, but many times during 1 hour. And if he stops breathing just for 30 seconds, 40 seconds, it means that there's not enough air that goes into the lungs. If there's not enough air in the lungs, not enough oxygen in the blood, and therefore the first thing that suffers, okay, or first thing is the body will tell you, hey, your brain tells you, wake up.
Wake up.
You need to start breathing. Okay, you need to take air, man. So that patient wakes up. So we have different stages of sleep. So if you wake up constantly, you don't get to the deep stage of sleep. And if you don't get to the deep stage of sleep, that means that, you don't rest. See, sleep, to get to a certain stage of sleep is where we erase where we concentrate is where we actually get the cognitive reception that we take.
Yeah.
Okay, that is like we store it, and we clean the memory.
But how do some people sleep for like half an hour and that's enough for that?
Yeah.
While others, I mean, I know it's off topic, but I just remembered my friend on the screen telling me that he needs 30 minutes of sleep per day.
Oh no, that's not so. Okay, so I'm a sleep expert, so I know a bit about sleep. So let's keep on just a moment so I can explain why.
Sure.
So if there's not enough oxygen, okay, your body tells you to wake up, but at the same time, okay, there's a decrease in the oxygen in the cells in the body. So the first thing that starts to be affected is your brain. That's where you lose memory. Okay, you tend to forget things. Okay, and the other thing that's important is that my heart starts to react also because there's not enough oxygen. So I'm going to have palpitations, heart problems, like and also the body tells, I need more pressure. I need more oxygen. So the blood pressure starts to raise, especially in the mornings when they're awake. Okay, their pressure is high. And also all the other organs, the pancreas, where patients become diabetic. There changes cholesterol. There are many changes. So about your friend, that is something interesting because you see, sleep is extremely important, but we have to sleep a certain amount of hours. It's not a matter of just sleeping, just for a few minutes and we're okay. It's impossible to sleep just a few minutes. If you sleep less than 4 to 5 hours, you're sleep deprived. And so in the morning, you're going to be actually like if you the next day, and I'm sure most of the people who actually, they went to bed late, they woke up early in the morning. Suddenly when they woke up, they feel like they were run over by a truck,
Right.
because they have not slept enough. But the reason why it's because you have to enter different stages of sleep to get the rest and the best. That's the reason why.
Are there, doctor, any lifestyle changes to wrap this up that can actually help make a difference for patients? And then we'll touch on treatments as well.
Sure. I mean, I do think that it's extremely important for patients to, or their family members to notify them, to tell them, look, it seems that you're not breathing well during the night. And that's one of the most important benefits. And then to be seen by a sleep specialist, they need to do a sleep test and to know if they have or not.
Okay. A lot of people hate sleep tests, but that's a different topic. I didn't want to touch on kind of like a new treatment. Let's say I don't want to call it revolutionary before you explain it. And we are talking about the hypoglossal nerve stimulation treatment.
That's right.
But you tell us more about that and how is it different? How is it going to change the lives of people?
Well, hypoglossal nerve stimulation is, as it says, the stimulation of nerve. I'm getting that. It's actually the nerve that opens up the airway. It's a nerve that pushes the tongue forward and at the same time the palate forward. So this type of treatment is very specific, and it actually is for those patients who do not tolerate the treatment that's called the CPAP.
Why is it different from the CPAP? Because we're aware of the CPAP.
That's right. The CPAP pushes air. And this treatment does not push air. It just opens up the airway in a very effective way, especially in those patients who aren't well selected. So it will open up the airway so the patient will be able to breathe adequately.
Okay. And the stimulator?
It's a stimulator. It's like a pacemaker.
Actually,
That's, there are different brands of hypoglossal nerve stimulation, but the one that we have here in Dubai, it's a little pacemaker that's placed underneath the tongue, underneath the skin and the chin area. And that's it. That is effective to open up the airway.
that's amazing. It's in Dubai.
It's in Dubai.
And you've already used this device on the summer.
That's right.
Dubai.
Yes, that's right. And we have another implant coming next week also. And so it's a great innovation. It's very promising. That's right.
That's amazing. We can't wait to hear more about the results of this device.
No, the results are fantastic. They're really amazing. It's not, I mean, unfortunately, here was approved very recently, but we've been doing it for many, many years already.
I hope
so. I've been doing it since 2016.
And that's interesting, and that's really promising and very insightful. We really thank you for being here, Dr. Peter. And could you just end with this, like, one quick key message to all our listeners about this topic? What would it be?
Sure. I think that the most important thing to have in mind is that snoring, it's true that it might be something normal. However, if in top snoring, they see that the patient that is having problems, difficulty breathing, on top of that, having other symptoms, they don't need to be checked. Okay, not by me. They need to be checked by a specialist.
Right.
Be able to.
Just don't overlook the issue as blah, whatever.
Exactly.
Right. Yes.
Snoring is not just a joke. It might be much more.
It's much more. Thank you again so much, Dr. Peter Baptista, for sharing your expertise on this important subject.
Thank you so much.
And thank you, of course. Of course. Thank you to our dear listeners for tuning in to Medical Dose. So don't forget, better sleep means better health. Until next time, stay well and sleep well.